These three men are responsible for one of the most amazing medical breakthroughs in cancer treatment in recent years. At the University of North Carolina in Chapel Hill, they've found a way to use simple skin cells to destroy one of the deadliest forms of brain cancer. Professor Matt Ewand is the chair of the Department of Neurosurgery and says there are many types of brain cancer.
When a patient gets a diagnosis of a brain tumor, it can be anywhere from a small benign tumor that can be watched or easily removed and cured with surgery, all the way to a tumor like the glioblastoma, which is a tumor that's generally not curable with surgery or radiation or chemotherapy.
Ewand and his group focus on glioblastoma. It's very common, highly aggressive, and kills indiscriminately. And it can strike anybody at any time. It's also particularly deadly, and on average, people who get it die within 14 to 16 months of the diagnosis. It's also very difficult to treat.
It's in the brain. So if you're a surgeon, as I am, and you're treating something that's in the lung or the colon, you can take a foot on the left and a foot on the right and make sure that you have all of the tumor. But in the brain, you can't go a foot on the left and a foot on the right.
Despite this, surgeons can remove the tumor successfully. However, this cancer has a further characteristic that makes it virtually incurable. It has a tendency to spread from very early on.
Even as a surgeon, when I look on an MRI scan and I see the tumor, I see a big white ball on the MRI and I show it to the patient and I say, that's the tumor. I know that the tumor has fingers that extend beyond that are in the normal brain. And even if I remove everything on the MRI that looks abnormal, there'll still be tumor cells that are in there.
So it's impossible to remove all the cancer cells with surgery. And the remaining cells make it possible for tumors to regrow, says Professor Sean Hintgen.
But what's really interesting is after surgery, the tumor is extremely angry. It comes back, it regrows actually 2 or 3 times faster than the tumor before surgery.
And strange as it seems, further treatment of this dread disease post-surgery has changed very little over many decades.
We still have chemotherapy, which really hasn't gone beyond the standard line, which is called Temodar or temozolomide. And we've been using that chemotherapy pretty regularly in the treatment of glioblastoma. Radiation has somewhat advanced as well. We have a fairly defined dose for newly diagnosed glioblastoma. And that's been the standard of care for the past 20 or so years.
Oncologist Professor Simon Kagi says the chemo and radiation merely delays the inevitable. This cancer returns because of the few cancer cells that invariably remain after surgery. The team then decided to approach the disease in an alternative way by working with stem cells. But that wasn't so simple.
A lot of people have heard of embryonic stem cells, which had a lot of controversy. And so because lots of times you had to sacrifice an embryo to do that, so it raised a lot of ethical concerns, religious concerns, things around that. And so there were a lot of constraints that were placed on stem cell research for a number of years.
But things changed drastically when the Nobel Prize for Medicine was awarded to 2 scientists in 2012. They were Sir John Gurdon and Professor Shinya Yamanaka, and they had shown it was possible to take mature skin cells and turn them into stem cells. Suddenly, embryonic stem cells weren't needed anymore.
This skin flipping reprogramming technology actually allowed you to accomplish many of the same tasks and promises that the embryonic stem cell technology offered, but without any of those ethical concerns, because you're simply starting with skin, going backwards and basically making something that looks like an embryonic stem cell, but it simply comes from your skin.
To turn skin cells into stem cells, it's necessary to reset the genome of the cell by adding certain master-regulated genes to the DNA. They use viruses to carry these genes into individual cells.
The advantage of a virus is it's very good at infecting cells. People are familiar with viruses. They're really good at infecting you. So what we're able to do is take kind of all the nasty bits that make you sick. We take that out of the virus and we put in the genes of interest that we want. So then when we introduce the virus onto the cells, instead of infecting and making you sick, it will actually insert those genes, the genes for the cell conversion, into the genome of your skin.
With their particular interest in the brain, the team started producing brain stem cells, otherwise known as induced neural stem cells. They knew these neural stem cells have a very peculiar characteristic.
neural stem cells from your brain, will chase cancer. They naturally home to tumors. So a lot of people think neural stem cell, they think about regenerative medicine and rebuilding the brain and the spine. Turns out there is this aspect of natural stem cells, the cells we all have in our brain, that allow them to naturally chase cancer. So they can follow the chemotactic signal, so the tumor is giving off signals that causes the stem cells to crawl and find them and localize with it. But once they localize with it, they don't really do much. They kind of bump up against the tumor.
But this was all they needed. They now had a way to sniff out even single, invisible cancer cells in the brain. And they had expertise in new cell-based technology that enabled them to also add further genes to the modified cells that would make them produce enzymes and agents that are toxic to cancer cells.
So we can either have the cells pump out anti-cancer things like antibodies, things like that, that would bind to the cancer and kill it. Or we can have them carry different enzymes, things inside the cell, so then when we give an inactive drug, the stem cell will actually convert it into an active anti-cancer agent and kind of create a halo of drug around the cell. And so therefore, when the cell crawls, finds the tumor, we can turn on the therapy and then kill the tumor in that area around it.
A special cloth-like material coated with millions of the modified neural stem cells carries the cells into the brain.
And so now what we actually are able to do is at the time of surgery, when the tumor comes out, we actually kind of wallpaper or line the surgical cavity with these scaffold stem cell composites. And that stabilizes the cells, but then allows them to crawl off and then go find the tumors.
They can even follow it live as it's happening.
We can label the tumor cells so that they'll show up red, and we can label the stem cells and they show up green, and then we can track and see that the cells will kill the tumor cells. So we can see as the stem cells hone in on the tumor cells die.
Here, a green-colored stem cell loaded with toxins has found a cancer cell colored red, and it is killing it within days. Their work with mice has shown that they were able to halt and even reverse tumor growth in mouse brains. This is a massive breakthrough, but what are the time frames?
The team is cautiously optimistic that it won't take long before the first patients receive the treatment. They reckon it'll be within a year from now.
I'm always optimistic, so we're going to try for a year and we're going to do everything we can to get there. Because again, looking out the window at the hospital, these patients don't have time for us to be slow or to fail. So we need to be fast and we need to be good at what we do. And so we're going to give it our best shot.